Hi everyone, it's Zoe here again from Living with a Sleeve. Lovely to see you on this Wednesday morning. I just wanted to get on today and have a chat with you about supplements, because this is something that keeps coming up time and time again. It's something I ask my patients about every single time that I see them, and it's something that I think lots of people kind of forget about or are a little bit sort of lax with, and perhaps knowing why you need to take them and exactly what you need to be taking might just be enough to remind you to start taking them every day. So thank you all for following. I've had lots of great responses on Facebook and Instagram lately. It's been really nice getting to know you, and hopefully, you know, being able to sort of keep going with these Facebook Lives every Wednesday is something that's going to be really helpful for you. So while we wait for a few people to jump on, excuse me, I just wanted to sort of reiterate that these Facebook Live sessions are for you. So if there are questions that you have, please just either comment in the comment section on the video, or send me a message on Facebook or an email, and I can sort of start to cover the topics that you're requesting. I'm really happy to do that. These are just sort of common issues that I've come across with my patients every day in the clinic, so I will keep covering those issues. But if there's anything specific that you want to know, just feel free to let me know. I've got a bit of a frog in my throat this morning, sorry, hopefully it's gone now. So supplements, these are something that are so important, and if you have any type of weight loss surgery, whether or not it's a sleeve or a bypass or a band, supplements become a part of your everyday routine, and there's a really important reason why that is. We know that because of the changes to the volume of food that you can eat, it's really difficult for you to get the nutrients that you need from your diet. Okay, there's just not enough volume. So take fiber for example, and I've written a post on this on fiber on my blog, because this is something that everybody goes, oh, I'm going to the loo fine every day, like every couple of days, I don't need it. To get enough fiber every day, which is 25 grams for women or 30 grams for men, you need to be eating like your 5 serves of vegetables, your 2 serves of fruit, your grains, legumes, and there is absolutely no way that with 3 cups of food and maybe a couple of snacks during the day, there's no way that you can get that amount of food in and that amount of fiber in every day. So that's why we need to supplement fiber. Other things we need to supplement include calcium for the same reason. You know, women should be eating 3 or 4 serves of dairy a day, and that's just impossible once you've had a surgery, especially a sleeve, just again due to the volume. And we see time and time again that there are common nutrients that people after a sleeve will become deficient in, and these include iron, B12 and vitamin D, for example. So there's a really good reason when we recommend supplements that we do recommend them. So please take note of this. It really does mean that your longer term health is more taken care of. Okay, you're reducing your risk of those nutrient deficiencies. So what do we need to take? Let's jump on into there. If you've got any questions as we're going along, please just pop them in the comments, and I will get to answering them as we go through. In terms of what you should be taking, there's a few things, all right? Your dietitian will probably have told you this already, or they will maybe make a little bit of adjustment depending on your medical history. So this is just really general advice, but this is what the guidelines sort of say for just the general population that have had a sleeve gastrectomy, all right? So first things first, you should be taking a multivitamin. Okay, you should actually be taking double the dose of a normal multivitamin. So 2 multivitamins a day if it's one of the 1-a-day multis like Synovus or Centrum or Swiss. You should also be taking iron, during the day. So this might be included in your multivitamin. So for example, sometimes I get my patients to take one Elevit and one normal multivitamin, or if it's not included in your normal multivitamin, then you should be taking an additional iron supplement. So we're aiming for 45 to 60 milligrams of iron per day, and that's from both from your food and from all of your supplements in total. So if you do the Elevit, there's 60 milligrams of iron in that one tablet. So that's why I get sometimes people to have one Elevit and then one a day multi every day. The other benefit of the Elevit is it's quite small. So a lot of the multivitamins are really enormous horse tablets, and some people can find it difficult to swallow. So taking the Elevit seems to be better tolerated with a lot of people that I see in my clinic. The next thing we need to take, so we've got multivitamins and we've got iron. The next thing we need to take is a calcium and vitamin D supplement. Okay, I try and combine this. Can get a little bit tricky because of the amount of vitamin D you need to take, and in Australia there isn't one fabulous sort of combination of calcium and vitamin D. You're looking for 1200 to 1500 milligrams of calcium, and that's from your diet and from supplements. So if you find that you eat quite a lot of dairy, maybe you have milk on your cereal, and then you always have cheese, and then you always have yogurt as a snack, you might not need as many supplements as somebody that isn't tolerating dairy and isn't able to eat very much at all. So your dietitian should sort of change that or alter that based on what you're managing to eat in your daily diet. The vitamin D, we're looking for 3,000 international units of vitamin D, which is quite a lot. So some people will take that as an extra supplement. And finally, a B12. So some people will have this, you can either do this as a sublingual spray, like underneath your tongue, or you could have it as a tablet, or you may even just need it as an injection every 3 months. And that really just depends on how well you're absorbing your vitamin B12. Okay. The last one that we spoke about briefly in the beginning is a fiber supplement. The fiber supplement that I normally get my patients to use is Benifiber. You can use something like Normafibe or Metamucil, but I find most people struggle to drink the Metamucil because it gets a bit gluggy, and you obviously can't scull a glass of Metamucil quickly after a sleeve. So getting the gel kind of texture down of the Metamucil just gets harder the longer you leave it to sit there. So Benifiber is clear and it's tasteless, and it just dissolves into anything. So often people will put this in their coffee or on their breakfast, or if they have a soup, or if they're, say, having mashed veggies, they'll just put it in their food and you don't notice it. So it's a really, really good supplement to take. That's definitely my favorite to use. So just recapping, we've got multivitamins, iron, calcium and vitamin D, a B12 and fiber. Okay, so there's 5 different supplements that you need to be taking every day. There is a little bit of a trick. All right, so calcium and iron do not play well together. And you also need to spread your calcium out over the day. So the timing of your supplements is really important. So what I find works well is if people have calcium with their breakfast, calcium and vitamin D with their breakfast, because they're normally having some sort of dairy, if they're having something like a cereal for breakfast, and then maybe calcium and vitamin D with lunch, okay? And then at dinner time, having your multivitamins and your B12, and then before bed, having another calcium and vitamin D, okay? Leaving at least 2 hours between the calcium and the iron in the multivitamin or the separate iron tablet, because they don't play well. It inhibits the absorption of the iron and the calcium. Okay, you can take B12 at any time of the day, so it really just depends on what works for you. And Also with the calcium and vitamin D, you might not need to take 3 a day, so you know it might be that you're only taking 2 a day, and then so it's sort of like breakfast, lunch and dinner you have something. Okay, so breakfast and lunch you have your calcium, and then at night time you have your multivitamin and your B12. So everybody is different. You should be getting routine blood tests, and your dietitian will probably then alter your supplements based on what your blood results are. So we do routine blood tests. We do one pre-op, and then we do one at 6 months and 12 months, and then just yearly after that is if everything looks stable. But we will do it more regularly if there's a need to, like say for example we found an iron deficiency or a B12 deficiency. So make sure that you are getting your blood tests done regularly, and you are keeping in touch with your surgeon and your dietitian at least once a year, just so that they can adjust anything from a supplement point of view if they need to. Alright, so I hope that has been really helpful. I haven't got any questions yet, but please, like I said, just comment below and let me know if there's anything that you're not sure of or anything that you want me to cover. Also, just a quick reminder that I will be on here every Wednesday, so please let me know if you've got a question or a theme or a topic that you'd like me to talk about next week or in a couple of weeks coming up. Also on my website there are a whole bunch of free downloads. So I've got my top tips for living with a sleeve, and my lunch options. There's 20 awesome lunches, so 10 to buy and 10 to take with you or to make at home. And also I will put together a PDF download of the supplements as well, so that you can have it quickly there, maybe sort of even make it wallet size so that you know how much and what you need to be taking each day, just as a reminder. And finally, there's also a survey that I would love and so much appreciate if you could spend the 2 minutes to fill it out. I really just want to get to know you and what you are looking for with this page and with my website, and the sort of, I guess it's essentially how can I help you best. So I will post the links to all of those things in the description of this video. So have a look in the description, and there's a quick link there. Literally it's just 2 or 3 questions in the survey, so it will only take a couple of minutes, but I would really appreciate if you could fill it out for me. And I think that's about it. So please let me know if there's anything I can do to help. I hope you have got something out of this today, and if you're not taking one of those supplements, I hope that you go to the pharmacy straight away and get sorted. And also put reminders in your phone so that you don't forget to take them. Tie your supplements to a specific thing that you do every day, for example cleaning your teeth, because it does, or driving the car to work, or booting up your computer, because it does really help to make it part of like a routine part of your day. Is really the only way that you're going to get them in every day without forgetting all the time. So perfect. I hope you have a lovely Wednesday, everybody, and I will see you next week. Cheers guys, bye.